Let us discuss about carcinoma stomach. First, we will discuss about risk factors of carcinoma of stomach. Risk factors. Risk factors will divide into nutritional risk factors, social risk factors, environmental risk factors, medical risk factors, occupational risk factors, and some other risk factors. Okay. First, we'll see the nutritional risk factors. Nutritional risk factors: low fat and low protein intake. Low fat and low protein intake. Second one is high complex carbohydrate intake. High complex carbohydrate intake. Increased intake of nitrates. Increased intake of nitrates. Salted meat. These are the nutritional risk factors. The first one is low fat or low protein intake, high complex carbohydrate intake, increased intake of nitrates, and salted meat. These are nutritional risk factors. Then moving to social risk factors. Social risk factor is low socioeconomic state. Next, environmental risk factors. The environmental risk factors are smoking, lack of refrigeration, use of well water. These are environmental risk factors. Then moving to medical risk factors. The medical risk factors are history of gastrectomy, history of pylori infection, Epstein-Barr virus infection, adenomatous polyp, chronic atrophic gastritis, Menetrites disease, These are the medical risk factors, and the occupational risk factors include These are rubber and coal workers. Other risk factors include male gender, and HNPCC. This is hereditary non-polyposis colon cancer. Hereditary non-polyposis colon cancer, and Lee-Fraumeni syndrome. Fromeney syndrome, pernicious anemia, pernicious anemia. One thing we have to remember here is alcohol is not a risk factor. Alcohol is not a risk factor. Alcohol is not a risk factor. Okay, this you must remember. Most of the people think that even alcohol also a risk factor, but that's not true. Alcohol not at all a risk factor for stomach cancer. Let's see the protective factors. These so far we discussed about the factors that increase the risk. So let's see the factors that decrease the risk of stomach cancer. Protective factors. We can remember this by mnemonic SIJAC. Okay, S means selenium, I means iron, Z means zinc, A means aspirin and vitamin A. Aspirin and vitamin A. C for calcium and vitamin C. Calcium and vitamin C. These are protective factors. Let us discuss about classification of stomach cancer. In this classification, we have two types of classification. One is Borman's classification, another is Lawrence classification. We have two classifications. One is Borman's classification. Second one is Lawrence classification. Let's see both of them. Let's see one by one. First one is Borman's classification. Borman's classification. In Borman's classification, stomach cancer has been divided into 5 types. Type 1, type 2, type 3, type 4 and type 5. In type 1, the stomach cancer is diffuse polypoidal growth. The stomach cancer, it presents as diffuse polypoidal growth. In type 2, it presents as ulcerative lesions with raised or elevated borders. It presents as ulcerated lesions with raised or elevated borders. Third type is ulcerated lesion infiltrated into the gastric wall. So ulcerated lesion with infiltration into gastric wall. Ulcerated lesion infiltrating into gastric wall. Infiltrating into gastric wall. Type 4 is Lineta plastica. Fifth type is non-classifiable. These are the 5 types. Then coming to Lawrence classification. Lawrence classification. In Lawrence classification, he divided the stomach cancer, or he classified the stomach cancer into two types. One is intestinal type and other is diffuse type. Intestinal type is the classical type. Okay, so he divided stomach cancer into two types. One is intestinal type, other is diffuse type. Intestinal type is the classic type. So let's see the differences between these two. In intestinal type, the risk factor is mainly environmental. Okay, but whereas in diffuse, it has got familial risk factors. Familial risk factor. Intestinal type is more common in males, whereas diffuse type it is more common in females. Intestinal type is usually seen in 5th to 6th decade of life. 5th to 6th decade of life, whereas diffuse type it is mostly seen in young patients or young peoples. Most common site for intestinal type is distal part of stomach, whereas for diffuse type most common part is proximal part. In intestinal type there is well defined gland formation. Okay, in intestinal type there is well defined gland formation, whereas in diffuse type there is poor gland formation. Intestinal type it spreads hematogenously. It spreads mostly hematogenous. Its spread is mainly by hematogenous spread, whereas in diffuse type mainly the spread is through lymphatic system. So lymphatic spread. Okay, let's see the common risk factors. The common risk factors for both intestinal and diffuse type is P16 mutation and P53 mutation. These are the common risk factors. Okay, stomach cancer is most commonly seen in Japan. Most commonly in Japan. Usually males are most often affected, that too in 6th decade. And most common site of carcinoma stomach is antrum. Most common site in pernicious anemia is fundus. Usually the most common site is antrum, but if the cancer arises due to the risk of pernicious anemia, then the most common site will be fundus. So most common site in pernicious anemia is fundus. So most common site of metastasis is liver. Most common site for metastasis is liver. Let's see the drug of choice for treatment of stomach cancer. Drug of choice can be remembered by a mnemonic ECF, where E represents epirubicin, C represents cisplatin, F referent 5-fluorouracil. These are important drugs used in carcinoma stomach. Let's see the clinical features of stomach cancer or carcinoma stomach. Clinical features of carcinoma stomach. The clinical features are: the most common symptom is abdominal pain. The most common symptom is abdominal. This abdominal pain is due to obstruction. Due to obstruction. There will be weight loss. If the carcinoma is close to gastrointestinal junction, then the most common symptom will be dysphagia. If the carcinoma is close to GE junction or gastrointestinal junction, then the most common symptom will be dysphagia. Lenitus plastica. The next symptom is lenitus plastica. Let's see what is lenitus plastica. Lenitus plastica, what happens is the stomach wall becomes like a leather bottle. Will have the texture of a leather bottle. So lenitus plastica is also called leather bottle stomach. So due to this, there will be early satiety. Let's see what exactly happens in lenitus plastica. In lenitus plastica, what happens is the cancerous cells, they infiltrate into the wall of, suppose this is stomach, right? So the cells, what they do is these cells, they infiltrate into the wall of stomach. So due to this infiltration, the texture of gastric wall will becomes like a leather bottle. Okay, hence it is called leather bottle stomach. The next symptom is lenitus plastica, and the next symptom is involvement of left axillary lymph nodes. There will be involvement of left axillary lymph nodes. Involvement of left axillary lymph nodes is called iris nodes. This involvement is called iris nodes. There will be involvement of supraclavicular lymph nodes. This sign is called Wichow's sign. Treisser's sign. Okay, the sign is Treisser's sign. These nodes are called Wichow's nodes. Involvement of the nodes which are the supraclavicular lymph nodes which are involved in stomach cancer are called Wichow's node. Usually Wichow's nodes is seen in abdominal cancers, not just related to stomach cancer. Even in other abdominal cancers also we can see involvement of supraclavicular lymph nodes. Then next symptom, cutaneous metastasis. deposits around umbilicus. Cutaneous metastatic deposits around umbilicus. This involvement is called Sister Mary Joseph nodes. Sister Mary Joseph nodes. Okay. And the next symptom is palpable intraperitoneal metastasis and digital rectal examination. Palpable intraperitoneal metastasis and digital rectal examination. This is called Brummer's self. Then involvement of bilateral ovary. That means there will be metastasis to liver. Metastasis to ovary. The involvement of ovary is called Krukenbach's tumor. Krukenbach's tumor. These are the important symptoms of stomach cancer. Next, moving to investigations. Investigation of choice is endoscopy and biopsy. Investigation of choice for staging is endoscopic ultrasound. Investigation of choice for staging is endoscopic ultrasound. Best investigation of choice for preoperative staging is contrast enhanced CT scan. Best investigation of choice for preoperative staging is contrast enhanced CT scan. Then we'll move to metastasis. 8th AJCC TNM classification. Let's see this 8th AJCC TNM classification of carcinoma stomach. T1S, we say T1S, it's not T1S, TIS, carcinoma in situ. TIS indicates carcinoma in situ or high grade dysplasia. Okay, TIS in the sense carcinoma in situ or high grade dysplasia. Then T1A in the sense Tumor invades lamina propria. Tumor invades lamina propria. Lamina propria. T1b invades submucosa. Submucosa. T2 invades muscularis propria. Muscularis propria. Next T3 T3 penetrates into subserosa. Penetrates subserosa connective tissue. Connective without invasion of visceral peritoneum and adjacent structure. Okay, these penetrates subserosa connective tissue without invasion of visceral peritoneum and adjacent structure. Without invasion of peritoneum and adjacent structure. Adjacent structure. T4a serosa involvement of serosa and visceral peritoneum. Serosa and visceral peritoneum. T4b involvement of adjacent structures. Adjacent structures. Then moving to involvement of lymph nodes. N1 involvement of 1 to 2 regional lymph nodes. 1 to 2 regional lymph nodes. N2 involvement of 3 to 6 regional lymph nodes. Regional lymph nodes. N3a involvement of 7 to 15 regional lymph nodes. N3b involvement of 16 or more lymph nodes. Then move to M or metastasis. It is non-metastasis. M1 means metastatic. Okay.